Today on the Health Informer, a special series playlist, supplements that you should strongly consider taking, a special playlist of our 4 most popular supplement series, including vitamin B12 deficiency, zinc, butyrate, and CoQ10, also known as ubiquinol. This series will automatically play following each other, perfect to listen to during long walks, workouts, or during travel. Today on the Health Informer, vitamin B12 deficiency and anemia. Vitamin B12 is required for proper red blood cell formation, neurological function, and DNA synthesis. What is B12 deficiency? Vitamin B12 deficiency occurs when there are inadequate levels of vitamin B12 in the body. For most people, a balanced diet provides all the vitamin B12 they need. Good sources of vitamin B12 include meat, fish, eggs, and dairy products. Despite the availability of vitamin B12 in a balanced diet, deficiency is not all that uncommon, particularly among people over 50 years of age, premenopausal women, and people who follow strict vegan diets. Causes of B12 deficiency. Low levels of vitamin B12 may be the result of a number of different factors and conditions. One of the most common causes of B12 deficiency is pernicious anemia. This is a condition where a person's immune system mistakenly reduces their ability to absorb the vitamin. Less common causes of deficiency include conditions affecting the stomach or intestines that interfere with absorption of vitamin B12, inadequate dietary intake, or certain medications. If left untreated, B12 deficiency tends to worsen and irreversible problems involving the nerves and brain may develop over time. The risk of experiencing a number of serious complications, including heart failure, may also increase. For this reason, it is important to seek medical advice without delay. What are symptoms of B12 deficiency? A person with vitamin B12 deficiency may notice general symptoms of anemia, as well as symptoms that are more specific to the condition. Symptoms more specific to B12 deficiency include pale yellow skin, red tongue, mouth ulcers and canker sores, constipation, pins, needles, numbness or other strange sensations in the hands, legs, or feet. Additional symptoms of B12 deficiency include vision disturbances, difficulty walking and balance issues, perceptible differences in mood, thoughts, and behavior, confusion and difficulty thinking, in severe cases signs of dementia, memory loss, irritability, depression, and psychosis. What causes B12 deficiency? Pernicious anemia is a common cause of vitamin B12 deficiency. There are several other possible causes of the deficiency, but they tend to be less common. What is pernicious anemia? In order for B12 to be absorbed by the body, it needs to be combined with a protein called intrinsic factor in the stomach. This protein is produced by cells in the stomach lining. In people with pernicious anemia, the body's immune system mistakenly attacks these cells, preventing intrinsic factor from combining with vitamin B12 and hampering its absorption. Pernicious anemia is an autoimmune condition that most commonly affects people over 50 years old, and women appear more likely to develop it. Pernicious anemia is thought to run in families and seems to affect people who have had other autoimmune conditions, such as Hashimoto's thyroiditis and Addison's disease. Your healthcare practitioner can order a blood test to check for pernicious anemia. B12 deficiency can also be caused by conditions affecting the stomach and intestines. People who have atopic gastritis, Helicobacter pylori, or a genetic condition that causes a lack of intrinsic factor can all cause B12 deficiency. Another cause can be people who have had Crohn's disease, celiac disease, or who have had surgery to remove part or all of the stomach or the end of the small intestine. Though fairly uncommon, some people may develop vitamin B12 deficiency as a result of low level in their diet. A balanced diet typically provides sufficient vitamin B12. However, strict vegans and people with a poor diet are at high risk of developing a deficiency. Good sources of vitamin B12 include meat, fish, eggs, and dairy products. How is B12 deficiency diagnosed? If B12 deficiency is suspected, your doctor will usually request a blood test. These tests measure levels of serum B12 and folic acid, as well as the size and concentration of hemoglobin within the red blood cells. However, this type of testing is not always accurate, as some people experience symptoms of vitamin B12 deficiency despite their blood tests indicating normal levels. The reason for this is that the test measures the total amount of the vitamin in the blood, but not all of it can necessarily be used by the body, and therefore there may be higher amounts of B12 in the blood that the body is not able to use. This is also known as functional deficiency. For this reason, your doctor may also test for folate deficiency. Treatment of B12 deficiency. Treatment will depend on the reason for the vitamin B12 deficiency. In most cases, having B12 injections or taking a prescribed oral supplement will be sufficient to treat the condition. Your doctor may recommend having high-dose injections of vitamin B12, usually in the form called hydroxychloroquine, every second day for 2 weeks or until the symptoms have cleared. Thanks for watching, and don't forget to like and subscribe. Today on the Health Informer, zinc, everything you need to know. Zinc is a nutrient that takes on many vital roles in the human body. Because zinc is not naturally produced by the body, it must be obtained through food or supplements. This video will explain everything you need to know about zinc, including its functions, health benefits, dosage, and potential side effects. What exactly is zinc? Zinc is considered an essential nutrient, meaning that your body can't produce it or store it. For this reason, you must get a constant supply through your diet. Zinc is required for numerous processes in your body, including gene expression, enzymatic reactions, immune function, protein synthesis, DNA synthesis, wound healing, and growth and development. Zinc is naturally found in a variety of both plant-based and animal foods. Foods that do not naturally contain this mineral, such as breakfast cereals, snack bars, and baking flour, are often fortified with synthetic forms of zinc. You can also take zinc supplements or a multivitamin supplement that provides zinc. Because of its role in immune function, zinc is likewise added to some nasal sprays, lozenges, or other natural cold treatments. Role in your body. Zinc is a vital mineral that your body uses in countless ways. In fact, zinc is the second most abundant trace mineral in the human body after iron and is present in every cell. Zinc is necessary for the activity of over 300 enzymes that aid in metabolism, digestion, nerve function, and many other processes. In addition, zinc is critical for the development and function of immune cells. This mineral is also fundamental to skin health, DNA synthesis, and protein production. What's more, body growth and development relies on zinc because of its role in cell growth and division. Zinc is also needed for your senses of taste and smell. Because one of the enzymes crucial for the proper taste and smell is dependent on this nutrient, a zinc deficiency can reduce your ability to taste or smell. Health benefits. Research shows that zinc has numerous health benefits, including boosting your immune system. Because it's necessary for immune cell function and cell signaling, a deficiency can lead to a weakened immune response. Zinc supplements stimulate particular immune cells and reduce oxidative stress. For example, a review of 7 studies demonstrated that 80 to 90 milligrams per day of zinc may reduce the length of a common cold by up to 33%. What's more, zinc supplements significantly reduce the risk of infections and promote immune response in older adults. Accelerates wound healing. Zinc is commonly used in hospitals as a treatment for burns, certain ulcers, and other skin injuries. Because this mineral plays critical roles in collagen synthesis, immune function, and inflammatory response, it is necessary for proper healing. In fact, your skin holds a relatively high amount, about 5% of your body's zinc content. While a zinc deficiency can slow wound healing, supplementing with zinc can speed recovery in people with wounds. For example, in a 12-week study involving people with diabetic foot ulcers, those treated with 200 milligrams of zinc per day experienced significant reductions in ulcer size compared to a placebo group. May reduce the risk of certain age-related diseases. Zinc may significantly reduce your risk of age-related diseases such as pneumonia, infection, and age-related macular degeneration, AMD. Zinc may relieve oxidative stress and improve immune response by boosting the activity of T cells and natural killer cells, which help protect your body from infection. Older adults who supplement with zinc experience improved influenza vaccine response, reduced risk of pneumonia, and boosted mental performance. In fact, one study determined that 45 milligrams per day of zinc may decrease infection rates in older adults by nearly 66%. Additionally, in a large study in over 4,200 people taking daily antioxidant supplements, vitamin E, vitamin C, and beta-carotene, plus 80 milligrams of zinc, decreased vision loss and significantly reduced the risk of advanced AMD. May help treat acne. Acne is a common skin disease that is estimated to affect up to 9.4% of the global population. Acne is driven by obstruction of oil-producing glands, bacteria, and inflammation. Studies suggest that both topical and oral zinc treatments can effectively treat acne by reducing inflammation, inhibiting the growth of P. acnes bacteria, and suppressing oily gland activity. People with acne tend to have lower levels of zinc. Therefore, zinc supplements may help reduce the symptoms. Decreases inflammation. Zinc decreases oxidative stress and reduces levels of certain inflammatory proteins in your body. Oxidative stress leads to chronic inflammation, a contributing factor in a wide array of chronic diseases such as heart disease, cancer, and mental decline. In a study in older adults, those who took 45 milligrams of zinc per day experienced greater reductions in inflammatory markers than a placebo group. Deficiency symptoms. Although severe zinc deficiency is rare, it can occur in people with rare genetic mutations, breastfeeding infants whose mothers don't have enough zinc, people with alcohol addictions, and anyone taking certain immune-suppressing medications. Symptoms of severe zinc deficiency include impaired growth and development, delayed sexual maturity, skin rashes, chronic diarrhea, impaired wound healing, and behavioral issues. Milder forms of zinc deficiency are more common, especially in children in developing countries where diets are often lacking in important nutrients. It is estimated that around 2 billion people worldwide are deficient in zinc due to inadequate dietary intake. Since zinc deficiency impairs your immune system, increasing the chances of infection, zinc deficiency is thought to cause over 450,000 deaths in children under 5 every year. Those at risk of zinc deficiency include people with gastrointestinal diseases like Crohn's disease, vegetarians and vegans, pregnant and breastfeeding women, older infants who are exclusively breastfed, people with sickle cell anemia, people who are malnourished, including those with anorexia or bulimia, people with chronic kidney disease, and those who abuse alcohol. Symptoms of mild zinc deficiency include diarrhea, decreased immunity, thinning hair, decreased appetite, mood disturbances, dry skin, fertility issues, and impaired wound healing. Zinc deficiency is difficult to detect using laboratory tests due to your body's tight control over zinc levels. Thus, you may still be deficient even if tests indicate normal levels. Doctors considered other risk factors such as poor dietary intake and genetics alongside blood results when determining whether you need supplements. Food sources. Many animal and plant foods are naturally rich in zinc, making it easy for most people to consume adequate amounts. Foods highest in zinc include shellfish, oysters, crabs, mussels, lobsters, and clams; meat, beef, pork, lamb, and bison; poultry, turkey and chicken; fish, flounder, sardines, salmon, and sole; legumes, chickpeas, lentils, black beans, and kidney beans. Other food sources include nuts and seeds, pumpkin seeds, cashews, hemp seeds, etc., dairy products, milk, yogurt, and cheese; eggs, whole grains, oats, quinoa, brown rice, etc. Certain vegetables, mushrooms, kale, peas, asparagus, and beet greens. Animal products such as meat and shellfish contain high amounts of zinc in a form that your body easily absorbs. Keep in mind that zinc found in plant-based sources like legumes and whole grains is absorbed less efficiently because of other plant compounds that inhibit absorption. While many foods are naturally high in zinc, certain foods, such as ready-to-eat breakfast cereals, snack bars, and baking flours, are fortified with zinc. Toxicity and dosage recommendations. Just as a deficiency in zinc can cause health complications, excessive intake can also lead to negative side effects. The most common cause of zinc toxicity is too much supplemental zinc, which can cause both acute and chronic symptoms. Symptoms of toxicity include nausea and vomiting, loss of appetite, diarrhea, abdominal cramps, headaches, reduced immune function, and decreased good HDL cholesterol levels. Ingesting too much zinc can also cause deficiency in other nutrients. For example, chronic high zinc ingestion can interfere with your absorption of copper and iron. Recommended dosages. In order to avoid overconsumption, stay away from high-dose zinc supplements unless recommended by a doctor. The recommended daily intake, RDI, is around 11 milligrams for adult men and 8 milligrams for adult women. Pregnant and breastfeeding women should consume 11 and 12 milligrams per day, respectively. Unless a medical condition is hindering absorption, you should easily reach the RDI for zinc through diet alone. The tolerable upper level for zinc is 40 milligrams per day. However, this does not apply to people with zinc deficiencies who may need to take high-dose supplements. If you take supplements, choose absorbable forms such as zinc citrate or zinc gluconate. Stay away from zinc oxide, which is poorly absorbed. Thanks for watching, and don't forget, please like and subscribe. Today on the Health Informer, butyrate. What is butyrate? Butyrate is a short-chain fatty acid. Fatty acids are the building blocks of fats that our cells need to function. To make butyrate, your gut bacteria transform dietary fibers found in whole plant foods. These are called prebiotics because they nourish and encourage the health-promoting activities of beneficial bacteria in the gut microbiome. Butyrate is the preferred energy source for the cells in your colon wall. It is essential for maintaining a healthy barrier between the colon and bloodstream, and it prevents inflammation in the gut. Unlike most other cells in your body which use sugar as their main energy source, the cells in the lining of your gut mainly use butyrate. Without butyrate, these cells would not be able to carry out their functions correctly. Butyrate production depends largely on the pH of the large intestine. Bacteria that produce butyrate thrive in a more acidic environment, whereas bacteria that produce other small-chain fatty acids, such as acetate and propionate, prefer a more alkaline environment. The good. Butyrate is a major energy source for colon cells. It is believed to help prevent colon cancer. It increases mitochondrial activity. It prevents toxins from crossing the gut barrier, improves insulin sensitivity, promotes healthy weight, fights inflammation, prevents the growth of pathogenic bacteria, and protects the brain. How does butyrate work? Butyrate inhibits HDAC, an enzyme that packs up DNA into tight, compact structures and prevents it from being expressed. In other words, butyrate loosens up DNA structures and increases gene expression. Drugs that inhibit HDAC are currently used to manage bipolar disorder and prevent epileptic seizures. Early research suggests that they may also be effective antidepressants. Butyrate is very important to your entire body, and many studies and labs show tremendous promise. However, there still remains a lack of major clinical testing on human subjects. Therefore, always speak with your doctor before supplementing with this or any supplement. Important functions of butyrate. Gut health. Butyrate is essential for maintaining a healthy environment in the gut. In the human colon, Anaerobic bacteria ferment carbohydrates and produce short-chain fatty acids, acetate, propionate, and butyrate. Colon cell energy source. Butyrate nourishes the colon wall, maintains a healthy lining and barrier function of the colon, and prevents intestinal inflammation. In the mitochondria of colon cells, 70 to 90% of butyrate is oxidized, which is then used to generate large quantities of ATP, the primary form of cellular energy. If you don't have enough butyrate-producing bacteria in your gut, you may be more likely to develop diarrhea, inflammatory bowel disease, and even colon cancer. Inflammatory bowel disease. Short-chain fatty acids, especially butyrate, can reduce the symptoms of inflammatory bowel disease. In one study of people with Crohn's disease, a type of IBD, butyrate supplements improved 69% of cases, with symptoms completely disappearing in 54%. Diarrhea and gut inflammation. Resistant starch is a type of soluble fiber that your gut bacteria can ferment into butyrate. A diet containing lots of resistant starch improved diarrhea in one trial. Butyrate can also prevent inflammation in stomach ulcers caused by alcohol. Mice given butyrate before alcohol had less inflammation and damage to the lining of their stomachs. Sodium butyrate in combination with other short-chain fatty acids and silicon dioxide was also shown to benefit traveler's diarrhea, a condition common among those who travel to exotic countries. Inflammation. Butyrate suppresses the activity of cells and proteins that drive inflammation. In one study on human cells, butyrate drastically reduced the activity of IL-12, an inflammatory cytokine, while increasing IL-10, which is generally anti-inflammatory. In mice, butyrate-producing dietary fibers counteracted inflammation and illness caused by bacterial toxins. The inflammatory cytokines inhibited by butyrate included IL-1, tumor necrosis factor alpha, and interferon gamma. B12 deficiency can also be caused by conditions affecting the stomach and intestines. People who have atopic gastritis, Helicobacter pylori, or a genetic condition that causes a lack of intrinsic factor can all cause B12 deficiency. Another cause can be people who have had Crohn's disease, celiac disease, or who have had surgery to remove part or all of the stomach or the end of the small intestine. Immune response. Butyrate may reduce inflammation by increasing the activity of immune cells called regulatory T cells, or Tregs. These specialized cells stop other immune cells in their tracks before they lose control. In turn, Tregs prevent the lining of the gut from overreacting to harmless food proteins. Gut barrier. Butyrate also strengthens the barrier formed by cells in the colon wall, thus preventing microbes and bacterial toxins from invading the bloodstream. Inflammation due to aging. As we grow older, inflammation increases throughout our bodies. In aging mice, a diet high in fiber that produces butyrate counteracted age-related increases in inflammation, suggesting that butyrate may be especially helpful to elderly. Human studies will be required to confirm this benefit, however. Fine-tuning the immune system. As an HDAC inhibitor, butyrate adjusts the immune system in a number of ways. HDAC inhibitors improve the tumor-targeting abilities of immune cells like T cells and natural killer cells. They are currently under investigation as a potential cancer drug. This class of compounds also reduces many inflammatory signals and increases Tregs, a type of white blood cell that prevents allergies and autoimmunity. Butyrate more specifically protects the gut barrier and prevents pathogens and other harmful agents from crossing into the bloodstream. Brain and nerve cells. The gut microbiome strongly affect the brain. Your gut bacteria talk to your cells by releasing butyrate, which as an HDAC inhibitor turns on certain genes. Cognition. Butyrate may improve learning and long-term memory. Similar to exercise, sodium butyrate increased brain-derived neurotrophic factor in mice. Simply put, butyrate supplies brain food to the hippocampus, the brain's hub for memory and emotions. This gives birth to new neurons called neurogenesis, a process that can reshape the brain. This effect has been repeated multiple times in animals, and probiotics containing butyrate-producing bacteria have been associated with reduced stress in humans. Brain injury. There's a huge overlap between cognitive enhancement and recovery from brain damage. Both rely on neurogenesis, a process that replenishes and reshapes the brain. In a mouse study, sodium butyrate given after a stroke supported the development of new nerve cells in the damaged areas. It also strengthened the blood-brain barrier in mice with brain trauma, which helped them to recover. Butyrate-producing bacteria also strengthened this barrier in mice. Weight regulation. Supplementation of short-chain fatty acids, including butyrate, has been shown to promote good gut bacteria, leading to weight loss in laboratory tests. In a trial of overweight people, butyrate-producing fiber supplements also led to reduced body weight and BMI. In another trial, short-chain fatty acids delivered directly into the colon increased the amount of fat being burned and energy being spent. In mice, the short-chain fatty acids, butyrate and propionate, but not acetate, prevented obesity and insulin resistance caused by a poor diet. Blood sugar regulation. People with diabetes often have gut flora imbalances. Less butyrate tends to be produced in their guts. A review study found that butyrate helped control blood sugar in both animals and humans with type 2 diabetes. Human studies have also reported associations between fermentable dietary fiber and improved blood sugar control. Additionally, in diabetic mice, butyrate decreased blood hemoglobin A1C, inflammatory cytokines, and liposaccharides, and also strengthened the gut bacteria. Allergies. Sodium butyrate improves symptoms and biological markers of allergy in mice with allergic rhinitis, hay fever. Liver and pancreas. Sodium butyrate prevented mice from developing non-alcoholic fatty liver disease, an inflammatory disease caused by fat building up in the liver. Sodium butyrate also blocked inflammation and protected the pancreas from inflammation in mice. Heart health. In a combined mouse and cell study, sodium butyrate prevented hardening of the arteries, atherosclerosis, by inhibiting inflammation. Cancer research. Butyrate has shown anti-cancer effects in cell studies. It inhibited tumor growth by promoting programmed cell death of cancer cells. Against colon cancer. In multiple cell studies, butyrate prevented the growth of tumor cells and encouraged cancer cell destruction in the colon. Several review studies show a link between high-fiber diets, which feed butyrate-producing bacteria, and a reduced risk of colon cancer in humans. Treatment of B12 deficiency. Treatment will depend on the reason for the vitamin B12 deficiency. In most cases, having B12 injections or taking a prescribed oral supplement will be sufficient to treat the condition. Your doctor may recommend having high-dose injections of vitamin B12, usually in the form called hydroxycobalamin, every second day for 2 weeks or until the symptoms have cleared. Butyrate side effects and safety. Butyrate is considered safe and beneficial in the quantities normally produced by a healthy gut flora. Food sources. You can get butyrate from food. For example, butyric acid is abundant in dairy products, especially butter. Eating more fiber increases butyrate production in some bacteria in your gut. Treatment of B12 deficiency. Treatment will depend on the reason for the vitamin B12 deficiency. In most cases, having B12 injections or taking a prescribed oral supplement will be sufficient to treat the condition. Your doctor may recommend having high-dose injections of vitamin B12, usually in the form called hydroxycobalamin, every second day for 2 weeks or until the symptoms have cleared. Depending on the composition of your gut flora, the following fibers may encourage them to produce short-chain fatty acids, including butyrate. Inulin, which includes artichokes, garlic, leeks, onions, and asparagus. Fruits and vegetables, including bananas, onions, garlic, and asparagus. Pectin, from apples, apricots, carrots, oranges, and others. Oat bran, gargum, and potato or plantain starch flours. Pregnant or breastfeeding women should probably not take butyrate, and remember, you should always speak with your doctor before starting any supplement. Thanks for watching, and don't forget to like and subscribe. Today on the Health Informer, CoQ10, also known as ubiquinol. 9 reasons you should probably be taking Coenzyme Q10, CoQ10, also known as ubiquinol. Coenzyme Q10, also known as CoQ10, or its slightly more absorbable form, ubiquinol, is a compound that helps generate energy in your cells. While your body produces CoQ10 naturally, its production decreases with age. Luckily, you can also get CoQ10 through supplements and foods. Health conditions like heart disease, brain disorders, diabetes, and cancer have been linked to low levels of CoQ10. It is, however, not clear whether low levels of CoQ10 cause these diseases or are a result of them. What is certain, and what researchers have revealed, is that CoQ10 has a wide range of health benefits. So here is all you need to know about CoQ10. What is CoQ10? CoQ10 is a compound made in your body and stored in the mitochondria of your cells. Mitochondria are in charge of producing energy. They also protect cells from oxidative damage and disease-causing bacteria or viruses. Since CoQ10 production decreases as you age, people seem to be deficient in this compound after age 50. Some other causes of CoQ10 deficiency include nutritional deficiencies such as vitamin B6 deficiency, genetic defects in CoQ10 synthesis or utilization, increased demands by tissues as a consequence of disease, mitochondrial diseases, oxidative stress due to aging, side effects of statin treatments, which is why most cardiologists prescribe CoQ10 to their patients taking statins. Research has shown that CoQ10 plays several key roles in your body. One of its primary functions is to help generate energy in your cells. It's involved in making adenosine triphosphate, which is involved in energy transfer within cells. Its other crucial role is to serve as an antioxidant and protect cells from oxidative damage. Excessive amounts of free radicals lead to oxidative damage, which can interfere with regular cell functioning and is known to cause many health conditions. CoQ10 is present in every cell of your body, but the highest concentrations are found in organs with the greatest energy demands, such as heart, kidneys, lungs, and liver. The following is a list of the 9 main benefits of CoQ10. Number 1. It may help treat heart failure. Heart failure is often a consequence of other heart conditions, such as coronary artery disease or high blood pressure. These conditions can lead to increased oxidative damage and inflammation of the veins and arteries. Heart failure occurs when these problems affect the heart to the point that it is unable to regularly contract, relax, or pump blood through the body. To make matters worse, some treatments for heart failure have undesirable side effects, such as low blood pressure, while others could even further reduce CoQ10 levels. In a recent study, people with heart failure who were treated with CoQ10 for 2 years improved their symptoms and reduced their risk of dying. It seems that treatment with CoQ10 could assist with restoring optimal levels of energy production, reduce oxidative damage, and improve heart function, all of which can aid in the treatment of heart failure. Number 2. It could help with fertility. Female fertility decreases with age due to a decline in the number and quality of available eggs. CoQ10 is directly involved in this process. As you age, CoQ10 production slows, making the body less effective at protecting the eggs from oxidative damage. Supplementing with CoQ10 seems to help and may even reverse this age-related decline in egg quality and quantity. Several studies have concluded that supplementing with CoQ10 may improve male fertility as well. Number 3. It might help keep your skin young. Your skin is the largest organ in your body, and it's widely exposed to damaging agents that contribute to aging. These agents can be internal or external. Some internal damaging factors include cellular damage and hormonal imbalances. External factors include environmental agents such as UV rays. Harmful elements can lead to reduced skin moisture and protection from environmental aggressors, as well as the thinning of layers of the skin. Number 4. It could reduce headaches. Abnormal mitochondrial function can lead to an increased calcium uptake by cells, the excessive production of free radicals, and decreased antioxidant protection. This can result in low energy in the brain cells and even migraines. Since CoQ10 lives mainly in the mitochondria of the cells, it has been shown to improve mitochondrial function and help decrease the inflammation that may occur during migraines. A study showed that people supplementing with CoQ10 were 3 times more likely to reduce the number of migraines. Number 5. It could help with exercise performance. Oxidative stress can affect muscle function and thus exercise performance. Abnormal mitochondrial function can also reduce muscle energy, making it hard for muscles to contract efficiently and sustain exercise. CoQ10 can help exercise performance by decreasing oxidative stress in the cells and improving mitochondrial functions. A study investigated the effects of CoQ10 on physical activity. Those supplementing with 1,200 milligrams of CoQ10 per day for 60 days showed decreased oxidative stress. Additionally, supplementing with CoQ10 can help increase power during exercise and reduce fatigue, both of which can improve exercise performance. Number 6. It could help with diabetes. Oxidative stress can induce cell damage. This can result in metabolic diseases like diabetes. Abnormal mitochondrial function has also been linked to insulin resistance. CoQ10 has been shown to improve insulin sensitivity and regulate blood sugar levels. Supplementing with CoQ10 might also help increase CoQ10 concentrations in the blood by up to 3 times in people with diabetes who typically show low levels of this compound. Also, one study had people with type 2 diabetes supplement with CoQ10 for 12 weeks. Doing so significantly reduced fasting blood sugar levels and hemoglobin A1C, which is the average of blood sugar levels over the past 2 to 3 months. Further, CoQ10 might help prevent diabetes by stimulating the breakdown of fats and reducing the accumulation of fat cells that could lead to obesity or type 2 diabetes. Number 7. It might play a role in cancer prevention. Oxidative stress is known to cause cell damage and affect their function. If your body is unable to effectively fight oxidative damage, the structure of your cells can become damaged, possibly increasing the risk of cancer. CoQ10 may protect cells from oxidative stress and promote cellular energy production, promoting their health and survival. Low levels of CoQ10 have been associated with up to 53.3% higher risk of cancer and indicate a poor prognosis for various types of cancer. What's more, one study also suggested that supplementing with CoQ10 may help reduce the chance of cancer recurrence. Number 8. It is good for the brain. Mitochondria, the main energy generators of brain cells, tends to decrease with age. This dysfunction can cause the death of brain cells in diseases like Alzheimer's and Parkinson's. The brain is very susceptible to oxidative damage due to its high fatty acid content and its high demand for oxygen. This oxidative damage enhances the production of harmful compounds that could affect memory, cognition, and physical functions. CoQ10 may reduce these harmful compounds, possibly slowing the progression of Alzheimer's and Parkinson's disease. And number 9. CoQ10 could protect the lungs. Of all organs, your lungs have the most contact with oxygen. This makes them very susceptible to oxidative damage. Increased oxidative damage in the lungs and poor antioxidant protection, including low levels of CoQ10, can result in lung diseases like asthma, chronic obstructive pulmonary disease, COPD. A study showed that supplementing with CoQ10 reduced inflammation in individuals who had asthma, as well as the need for steroid medications to treat it. Because CoQ10 is a fat-soluble compound, its absorption is slow and limited. However, taking CoQ10 supplements with food can help your body absorb it up to 3 times faster than taking it without food. Your body does not store CoQ10, therefore its daily use is recommended. There are also food sources of CoQ10. While you can easily consume CoQ10 as a supplement, it can be found in some foods. It appears that CoQ10 is equally absorbed in either capsule form or through foods. The following foods contain CoQ10: organ meats, heart, liver, and kidney, some muscle meats, pork, beef, and chicken, fatty fish like trout, herring, mackerel, and sardines, vegetables such as spinach, cauliflower, and broccoli, fruit like oranges and strawberries, legumes like soybeans, lentils, and peanuts, nuts and seeds like sesame seeds and pistachios, and oils like soybean and canola oil. Thanks for watching, and don't forget to like and subscribe.